call to order the community teleconference for January 7th. The time is 6 p.m. Madam Clerk, please call the roll.
Thank you. Mr. Ronnie Felder, Mayor. Dr. Julia Botel, Chairperson.
Here.
Mr. Douglas Lawson, Chair Pro Tem. Mr. Trodrick McCoy, Councilperson. Ms. Kashamba Miller Anderson, Councilperson.
Present.
Thank you. Ms. Shirley Lanier, Councilperson. Okay, Ms. Noel, you can proceed.
Thank you.
All right. Thank you, Ms. Smith. All right, so we're going to go ahead and get started. Good evening, everyone. My name is Marsha Noel, Assistant to the City Manager, moderating tonight's call. With me this evening, we have Chief Kurd serving as our Operations Section Chief for our Emergency Operations Center, and our City Manager, Jonathan Evans. They will be providing pertinent information regarding the latest updates on COVID-19 and city operations. Therefore, I encourage our listeners to let others know about this call, to share this on social media, tell your friends and neighbors residing in this city, because I think there's information you would not want to miss. After staff provides their updates, we will open the floor to any elected official on this call to ask any questions or share any final remarks. With that being said, we're going to go ahead and start with a few statements from our City Manager, Jonathan Evans.
Thank you, Ms. Noel, and thank you, Madam Chair and members of the council and the community. This is a situational briefing with regards to COVID-19. Obviously, everyone knows that we've been combating this virus head-on since March of 2020, and obviously we find ourselves in 2021 dealing with other issues associated with the virus. We have seen the numbers continue to increase, and Chief Kurd will get into more specificities with regards to that. As it relates to the modified work deployment schedules that we do have, we are in an Alpha Bravo Charlie, depending on the size of the operation, to ensure continuity of government. We are making sure that operations are consistent throughout the entire pandemic, and that we have made sure that there's appropriate safety procedures and protocols in place to limit the potential for persons in the agency contracting COVID. One of the challenges associated with this virus is that obviously it's not a Monday through Friday, 8 to 5 virus. It's something that if people let their guard down outside of their employment, there is situations that persons end up becoming positive as a result of a contact with a person that does have COVID. And we've had situations whereby we've had to shut down certain operations or modify work plans to be able to address those issues within the organization. City administration is consistently reviewing the staff deployment plan and model. One of the things that we do want to make sure is that we can consistently and uniformly continue to provide service to the residents of the community. We do not want to see a situation where we have an inability to serve because of the virus. And so we have made sure that the leadership as well as the frontline staff and our essential personnel are safe and in places that we can continue to provide the services that are uniformly enjoyed by the community and are intended to protect the health, safety, and welfare of the public. Currently, right now, all our facilities are open. However, there are modified activities. Certain things such as recreational activities have been postponed, but the staff is assisting with other activities throughout the agency, whether it's community food distribution to assisting with inventory and other activities that we have them doing. But all our facilities are open, and there may be limited activities that are accessible to the public, but our employees have remained whole throughout the entire pandemic, so they have been working and they have been receiving their normal compensation, even if there are situations where persons are working at home or not providing any service. We have continued to maintain our payroll practices to ensure that individuals are receiving compensation throughout the onset of this pandemic, and when needed, they are utilized in multiple capacities in and outside of their normal daily activities. As it relates right now, we have 14 employees that are COVID positive and over 40 that are under observation. We've seen the numbers increase exponentially in the organization as a result of the holidays, and we knew that people would be experiencing time with their family, friends, and unfortunately letting their guard down. And so we're consistently monitoring those persons that are COVID positive and those that are under observation. Currently, we do have one employee that is hospitalized, and staff is making sure, as we've done with everyone that has contracted the virus, consistently monitoring them on a daily basis to ensure that if they need any help or assistance, that can be provided. Employee testing still remains free. However, we may have to look to make modifications to our testing model for the public, as we know that the CARES funding has expired and there has not been additional monies that have been appropriated by the federal government for the purposes of facilitating public testing. So there may be an item that comes before the board to ask for direction or clarity as to how we should continue or how we may possibly modify the testing. There is cost for the agency as it relates to employee testing that our insurance carrier provides, but we are going to make sure that that doesn't adversely impact our renewals in subsequent years. So we will continue to monitor that, but we can anticipate as a result of COVID activities that insurance costs will end up impacting the organization one way or another. We still continue to do our community food distributions where we're serving over 200 persons per day, and we will continue that until the end of January. And every opportunity that we have to extend it, we do go ahead and extend it, and we will continue to do so. The activities that are happening at our food distribution site and the food that we are getting, we will continue to provide it. But again, it is not solely the City of Riviera Beach's activity for the distribution. We have to get the produce and the product from another entity. And if they're unable to provide that, or when they can no longer provide that, that's when we look to, again, shutter the operation. But we will provide food to our community as long as possible and as long as it is readily available to us. We have put in a request to the county to receive a reimbursement of approximately $530,000 related to COVID expenses. This was an item that came before the board, and the board authorized staff to proceed forward with requesting monies from the county related to the COVID activities. The county did ask for additional information, of which the city did provide, and we can anticipate some type of reimbursement from the county in February. And so once that is received by city staff, I will make sure that the board and the community is informed accordingly. One of the things we have also continued to do is provide masks. We are doing mask distribution concurrently with our food distribution to ensure that we continue to provide these masks to our community, as well as children's masks are available. If there is ever any request from any member of the community or any agency that needs masks, we have been able to provide masks to businesses as well as persons that were having any activity that we wanted to ensure that they were practicing all the things that we've communicated from the CDC to ensure the safety and welfare of those that were in activities that social distancing could not be preserved. You will also hear today from Chief Curd more specifically about the vaccination of the community and what we have done preemptively to prepare for this. This was something early on, the onset of the pandemic. Chief Curd and myself and the team talked about that we wanted to be one of the first communities to have a closed point of distribution for the vaccination of our community. We are moving in that direction. We have adopted all the policies, filled out all the applications, and have already prepared ourselves for the purposes related to the vaccination of our community. The town of Palm Beach, which Chief Kurd will get into more specificities, was able to secure vaccines and was able to vaccinate about 20% of their population. We have made contact with the town of Palm Beach and will be visiting the town of Palm Beach to look at how their operations will be deployed here in the next couple of days to ensure that we can improve upon lessons learned from the town of Palm Beach and make sure that we can do so safely in our community. So we will be, if we are fortunate enough to receive the vaccine, be providing it to our community. One of the things that we certainly need the assistance from the elected officials as well as members in the community. If you know anyone that is in the state legislature, if you know anyone that has the ear of the governor's cabinet, if you know anyone that knows the governor, we certainly need the assistance of all parties to advocate for the distribution of the vaccine to Palm Beach County, because it is very challenging for all 64 counties that are competing against one another, as well as all 50 states. The vaccine is provided by the federal government to the state, and then the state determines the distribution. So members of our House of Representatives, as well as our state senators and our governor, any connections that we do have, we certainly want to make sure we exercise those relationships so we can advocate for the vaccine coming to our community as quickly as possible. I will be placing an item on the agenda to have a resolution sent to the local delegation of Palm Beach County advocating for the vaccine to be provided to Riviera Beach and the residents of Palm Beach County. And lastly, we are going to continue to advocate that folks do everything that we have shared was related to the guidance that's been provided from the Center for Disease Control as it relates to wearing masks, washing your hands, utilizing hand sanitizers, social distancing, everything that we have been talking about since March is certainly still relevant and still needs to be applied, because we are seeing the numbers increase over the numbers that we experienced when things were shut down. And we have heard that the governor has further reiterated his perspective that he does not wish to give or grant local jurisdictions the opportunity to move forward with any closures or place restrictions or what have you. So the only thing that's going to allow for us to get into a better situation is by exercising all the things that the CDC has provided us since the onset of the pandemic. So with that being said, I'm going to turn the presentation over to Chief Kurd to provide an operational report concerning COVID-19. Chief Kurd.
Thank you, Mr. Evans. John Kurd, Fire Chief, serving as Emergency Manager, Operations Section Chief. I would urge everyone to grab a pencil, pen, paper, as at the conclusion of my presentation, I'm going to have some very important information for anyone who's interested in getting the vaccine, registering for the vaccine, or being updated on the status of the vaccine as it relates to Florida and Palm Beach County. As I always do, I start off with the numbers to illustrate what is happening with the virus. In the U.S., there have been over 21.4 million cases since the onset of the pandemic, and we are now at 361,000 deaths in the United States. It's anticipated that there will be 500,000 deaths by the end of February or into March. Florida has seen 1,409,906 total cases, with 22,647 total deaths. Palm Beach County is at 87,683 total cases, with a total of 1,923 deaths. As it relates to what the virus is doing in Florida and in our county, yesterday's positivity rate for the state of Florida was at 12.54%, and Palm Beach County was at 11.44%. These numbers are important because it tells us what the virus is doing. We know that once we've eclipsed the 10% threshold, the virus is considered to be community spread, which basically means contact tracing is ineffective because an individual can't tell you where they got the virus from, where they've been. It's just impossible to track it to that extent. And we are well above those numbers and have been above those numbers for some time now. The Census Tract data is another metric that I look at to see what's happening within the city of Riviera Beach. Unfortunately, some of the Census Tract areas bleed into other municipalities around us, but it gives me the best look at Riviera Beach. And currently there are 3 Census Tract areas in Riviera Beach that are considered hotspots, meaning in 3 of the 12 Census Tract areas that touch Riviera Beach, 3 of them have numbers where 30 to 60 people have tested positive within the last week. So if we look at that, that's anywhere between 90 to 100, and they give you ranges. I can't get to the specifics. They use ranges of numbers, and 30 to 60 is the range that 3 of our Census Tract areas fall in. So 90 to 150 people in the city of Riviera Beach, in just those 3 geographic areas, have tested positive for COVID-19 within the last 7 days. So it is extremely active. Now, this is not disproportionate to what we're seeing in the rest of the county. This is happening throughout Palm Beach County, so it's not just a Riviera problem, but I wanted to express what is happening in Riviera as is happening all over Palm Beach County. We'll talk a little bit about testing. As Mr. Evans previously mentioned, their CARES Act funding did expire on December 31st, so there is no longer federal monies available for the food distributions, for the testings, for the mortgage forgiveness plans, all of those small business plans, and all of those things that we have seen throughout this pandemic came to an end on December 31st in regards to financial support and help from the federal government. What does that mean for us in Riviera Beach as it relates to testing? Is testing now is not free and readily available to members of our community through the sources that we have been able to utilize in the past, who were providing this testing at no cost because their reimbursement was coming from CARES Act funding. You can still obtain free testing at the ballpark of the Palm Beaches. That funding is coming through Palm Beach County's health department and their mechanisms on obtaining funds, but the private entities, the Black Nurse Practitioners of Palm Beach County, United Health Labs, American Care, all of those entities now have to revert back to charging for the cost of COVID-19 testing. But again, testing is still free and it is still available at 15 ballpark of the Palm Beaches. That's why you may have seen on the news, or if you've driven by the ballpark, the lines that are wrapped around and at sometimes exceed over 1 mile in length, because that's the only place people can go right now for free testing. We're going to continue to work on trying to obtain testing at the lowest possible cost for not only our employees, but for our residents. But there are no CARES Act monies available. There is conversation of money becoming available when the next president takes office. Maybe he will reauthorize some additional funding, but we're going to have to wait and see when that happens. We have worked with Palm Beach County's Health Department mobile testing unit. They will be coming to Riviera Beach once every other week and providing testing to our community at no cost. Unfortunately, I can't have them there every day, or I would. We have to share them amongst all the municipalities and all of the cities in Palm Beach County, but I did get a verbal commitment that they will be with us once every other week, and we will make sure that we get that information out to our community on our social media platforms, through our emails, and these events where we are updating our community. Now, what's really important, we all want to hear about the vaccine. First of all, I want to address the elephant that's in the room, and this elephant's been in the room for quite a few days now. How does the town of Palm Beach receive vaccine for their communities while no other municipality received vaccines for their community. Talking to the director of the Palm Beach County Health Department, Dr. Alonso, it was a mistake. It was a misunderstanding on vaccine distributions where vaccines were being delivered and they were being given to municipalities, even though Dr. Alonso requested that that not happen. Town of Palm Beach received their vaccination before word could get to the people distributing the vaccine that they are not to distribute to municipalities. Take it for what it's worth. I'm not the judge. I'm not the jury. That is the words of Dr. Alonso. It was a misunderstanding. It was not to happen. It shouldn't have happened. It won't happen again. But all municipalities and all the fire chiefs amongst all of the 12 fire departments in Palm Beach County have banded together to ensure that their municipalities receive vaccine once it becomes available. That leads us to the next point of conversation, once it becomes available. Supply has not met demand. There is a tremendous, actually there is a greater demand for the vaccine than what was anticipated. This is a very difficult situation when we're talking about distribution of the vaccine, because ultimately, and just a little teaching point, when the vaccine is to be distributed by the federal government makes a determination on what states get what number of vaccine. Once the vaccine arrives to the state, our governor determines what counties get the vaccine and in what quantities. Once the vaccine reaches the county, the director of the health department of that county is responsible for the distribution and mechanisms of distribution of that vaccine within that county. So there are a lot of decisions made on how the vaccine gets to Riviera Beach well before Riviera Beach even has say-so on how much, how often, and when we want the vaccine. So to Mr. Evans's point, to our elected officials, to our community members, if we can put pressure on our governor, if our governor can put pressure on the state, we need the vaccine in the state of Florida, but more importantly, we need the state of Florida to get the vaccine to our health department in Palm Beach County, and we need our county's health department to get that vaccine to Riviera Beach. I am working with every organization and entity I know, but we're going to need to get above them and really get to those lobbyists, those congresspersons, senators. That's who we need to be in the ear of to make sure we get what we are due in Riviera Beach. Riviera Beach has planned for a closed pod. This planning has gone back into last year. We've established a plan. We've submitted the plan. The plan has been approved. All MOUs, memorandums of understanding, have been reviewed by legal. They have been signed. They have been returned. Our medical director, Dr. Seavold, who is Riviera Beach Fire Rescue's medical director, will be serving as the City of Riviera Beach's medical director, has registered our municipality with a system called Florida Shots so that we can obtain and distribute the vaccine. So a big thank you to Dr. Seavold for not only serving Riviera Beach Fire Rescue, but stepping up and serving the City of Riviera Beach. Our closed pod plan is in place and ready to go, and we have committed to distributing 150 vaccines a day, 5 days a week, being Monday through Friday, which will total 750 vaccinations a week. Now, that's how much I would like to do, but I could only do what the supply allows me to do. And you have to remember, when we talk about these vaccines, we're not just talking about what's available today. That same number of vaccine has to be available 28 days from now. So for us to get vaccine today, distribute it, and whether it be Moderna or Pfizer can now not keep up with the demand, individuals will have wasted that first vaccine because they can't get the second. So when I'm talking about obtaining 750 vaccines, we're all actually talking about 1,500, because not only do you get that first shot 28 days, you will be getting that second shot that is required for the vaccine to take full effect. We will be informed once the governor and the health department have worked to obtain sufficient quantity of the vaccine, when we will receive that vaccine. Once we are notified that we will be receiving the vaccine, we will activate Riviera Beach's call center. Our call center will be taking registration for individuals once we know the vaccine is available. We will not begin the registration process without vaccine in hand, but once we are made aware, we will activate our call center, and we will go ahead then and activate our closed pod for distribution to our community and our community alone, which will be staffed by 10 to 15 personnel daily. Please understand, Council, as you some of you are on this call, and I'm sure all of you will listen to it, we're going to need your support in this, because we can't opt into a closed pod program and then see what the cost associated with it will be and then back away from it. If we say we are going to do this, we need to stand by our word and do it, regardless of cost and regardless of how long we will need to do it for. I don't know what the cost is going to be, but I can assume that there will be a significant cost. And this may go on as vaccine rolls out for the next 4, 6, 8, 12 months. But this is what I'm sure you would want for the community. This is what Mr. Evans has expressed to me that he wants to ensure happens in our community. And this is what I want to do for our community to preserve the health, safety, and welfare of our residents in Riviera Beach. So we have submitted our request to operate a closed pod, and we're going to need your continued support as we do that. Now, as I've asked you to get a pen and paper, I got some important information. I want to start off first with what residents can do right now to register for a vaccine through Palm Beach County's health department. The best way, and right now I would tell you the only way to get a hold or to get a place in line is to email this email address. It's CHD, Charlie Hotel Delta, 50 feedback at flhealth.gov. That is CHD 50 feedback at flhealth.gov. Once you submit that email, you need to ensure your name, your birth date, your phone number, and your home address, including zip code, are in that email, and just put in, in your subject that you are vaccine registration. So emailing CHD 50 feedback at flhealth.gov, subject vaccine registration, name, date of birth, phone number, address with zip code will get you a place in line. They will only call you to register you and schedule your appointment once the vaccine becomes available. You may not get a call for 1 week, 3 weeks, 5 weeks. But when the vaccine becomes available and they get you your name on the list, they will call you to schedule your appointment, as scheduling an appointment now for a vaccine they don't have in hand is not going to happen. If you want further information about the vaccine happening in updated vaccine information for Palm Beach County, you can go to the website of palmbeach.floridahealth.gov. Again, for the latest information on the vaccine in Palm Beach County, go to the website palmbeach.floridahealth.gov, and that'll give you the latest up-to-date information on the vaccine. You can also follow the health department on Twitter at HealthyFLPBC. Again, it's the @ HealthyFLPBC. And finally, should you want to receive information from the governor's office about the state of the vaccine in the state of Florida, you can text the phone number 888-777. You will send the message FL COVID-19 and hit send. So you are texting the message FL COVID-19 to 888-777. Once you send that that text message, you will receive a reply that you have been put on the notification list, and they will request your zip code. You'll send that back to them, and you will get the latest up-to-date information as it relates to the vaccine in Florida. I've given you the website for Palm Beach County, and you can always follow Riviera Beach's information. And all of this information is contained on Riviera Beach's site. Follow us on Facebook, Twitter. You can go to our website, or at any time you can call the city of Riviera Beach. Mr. Evans, that concludes my update. I turn it back over to you.
Thank you, Chief Kurd. Madam Chair and members of the board, that concludes our update, and staff is prepared to answer any questions that you may have.
Thank you. It's Julie Botel. I just have one thing to add to what Chief Kurd said. I submitted that email to CHD50 feedback on January 2nd at 1:21 p.m., and I immediately received an email back saying, thank you for contacting the Florida Department of Health in Palm Beach County, et cetera. And it was a lengthy email that told you everything about, who to call for more information. And it tells you, you do not need to call our appointment line again, and please do not show up at any of our Florida Department of Health locations until you are given an appointment to do so. So if you do send that email, expect to get an email in return right away. And I think if you don't, then you may have done something wrong with the email address or something. So be sure you check that it's CHD50 feedback. And again, you have to give them your birth date and your address and zip code. So I think that's all I have to say. Councilwoman Miller Anderson, do you have anything to add?
I just wanted to make sure that everyone understood that from my position, I certainly would be in support of trying to do whatever we can that's brought before us so that we're able to provide these opportunities for our residents, because as we can see, the numbers are going up drastically. Today in the country, we had a high number again. I mean, every day we're breaking records. And so we already know from past experience how it's impacting those in communities like ours. And so I would certainly look forward to receiving all of the information and being able to support our residents the best that we can. I want to continue to tell people to, this is not the time to get comfortable and relax and not wear your mask and start hanging out. Any areas, I would certainly say, Mr. Evans, there's certainly been some conversations that I've heard from residents and business owners that are concerned about some areas in the cities that may have had large gatherings. And I just want to make sure that the residents are aware that we are still taking those things seriously, and that needs to be looked into, and because we don't want to have super spreaders around here. If people are having things, they are supposed to be having their masks on. And so I look forward to having more information about any of those areas that are having those issues and how it's being addressed. And as always, I thank you all for everything that you're doing. This has been almost a year now that we've been dealing with it. It doesn't seem that long, but it really has been a long time, and you all have been doing a great job in continuing to update the residents in the community with ways and how they can either get a vaccination or how they can get tested, and just being able to provide assistance to our community. So I just thank you all for that.
I agree wholeheartedly. Thank you so much for the work you've been doing, and especially for the excellent job of communicating with the community. Is there anything else, Mr. Evans, or can I adjourn this meeting?
There's nothing else unless there's. Go ahead, Marcia.
Go ahead, Marcia.
Yes, so I just wanted to remind the community to stay connected with the city. We do have regular newsletters that go out associated to COVID-19, city operations, what have you. So if anyone who is listening to this call have not yet signed on to our electronic newsletters, you can do so by going to the city's homepage at riverabeach.org. Go to the very bottom, input your information, stay connected to our website, stay connected to our social media for more information, and that's all I got.
Marcia, one thing I just forgot. Oh, hello. One thing,
sure,
please.
Go ahead.
Citizen Leadership Academy. We can't forget that. I understand last night we were going to have some information provided and given to the residents. So because we weren't able to do that, can we quickly just kind of let people know what we're doing and the dates that it needs to and how they can apply?
Yes, certainly. Thanks for bringing that up. So yes, we are going to resume our Citizens Leadership Academy this year. It will be held virtually this time around due to COVID-19, but applications are now open. This 7-week program is an opportunity to invite our community stakeholders into city operations. You'll be able to hear from various department directors who will be engaging with you to inform you, to interact with you about what it is that we are doing and how it is that we serve you as a community. So if you are interested in signing up, applying for this opportunity, please go to rivierabeach.org/CLA for more information and to apply online. We are looking to host our cohort of about 25 participants. We already have been receiving applications, so if you have not yet applied, please consider doing so, especially if you truly have a stake in this community. And with that, that's all I have.
Thank you so much.
Thank you,
Appreciate it.
Thank you, Commissioner Miller-Anderson. As a proud graduate of the Citizens Leadership Academy, I highly recommend that people attend. And if there's nothing else, thank you. This meeting is adjourned. Good night.
Good night.